Well, we know that exercise is good for people with osteoarthritis, but a lot of people might have trouble accessing health professionals like physios to get an exercise program. So they might be living in remote areas, or they might have trouble getting transport to a physio clinic. So providing physio over the phone or video is a potential way to improve the accessibility of physio services. So we just wanted to know what people with osteoarthritis would think about using the phone or video to receive physio, and whether they'd actually be willing to use these kind of services. I think the main advantages would be the time saving and convenience advantages. So obviously people don't have to travel to and from a clinic. They can consult from their own home or their own work. And it's a bit more of a flexible way of consulting probably. So if they're even on holidays, they could just chat on the phone to their physio or get their tablet and talk over Skype. Well, I guess because it's reliant on technology, there's bound to be a couple of technical issues maybe. So the physio and the patient would need to have a reliable internet connection. Obviously they'd need to have a tablet or a PC with a camera and a microphone. And then if they're using the phone, they need to have reception, a fully charged phone, just little things like that. And also if people are maybe not so familiar with technology, like using Skype or using a tablet, it might be a bit more difficult for those people. So we conducted a survey of people with knee and hip osteoarthritis, and the survey basically comprised of 2 sets of 17 attitude statements about receiving an exercise program from a physio over the phone and via video. So these attitude statements asked about things like the acceptability of receiving the care in this way, whether they'd be willing to use these kind of services, whether they'd be willing to pay for the services, and yeah, things like that. It took about 6 months to get 330 complete survey responses, and it took each participant about 6 or 7 minutes to complete the survey. Probably recruiting the respondents, that was a little bit slow at times, but we got there in the end. I think almost everyone had a mobile phone, and only about 60% of the cohort had or owned a tablet or a PC. And I think all of them had internet access. So our cohort was probably mostly pretty technology savvy, but yeah, a lot of people might not be, because we got most of our participants from Facebook, so it's probably a bit biased. So overall I'd say that people had positive attitudes towards telephone and video delivered care, and they were most positive about things like the time saving advantages, how convenient it would be and how easy it would be for them to use the phone and video. But there was also some concerns about the lack of physical contact with the physio when consulting like that, and also a minority of people were willing to pay to use a service over the phone and video. I guess it would be good for them to know that people with osteoarthritis, or most people, would be willing to use a service offering video or telephone delivered care. So if they have the resources available, they could consider offering care over the phone or by video. I think the next step would probably be some qualitative studies to look a bit further into why people have these attitudes, like why they are concerned about the lack of physical contact with the physio, and yeah, things like that, to get a better understanding of why they think the way that we found they do.